Hello and a warm welcome. Dr. Sil here. I'm a junior doctor from Australia training to become a psychiatrist, and I make mental health education videos. In today's video, we are talking about trichotillomania and excoriation disorder. Now, these behaviours are compulsive symptoms. That is, they are very hard to stop and they are associated with self-injury. So they cause some form of damage. So trichotillomania, pulling of the hair, obviously can cause damage by causing bald spots and removing hair physically. And excoriation disorder, scratching and picking at the skin picking, can cause literal lesions on the skin. Now, it's important to note that trichotillomania is a terrible name to describe the symptom. There is nothing manic about trichotillomania. Yes, someone with mania might have trichotillomania, but someone with trichotillomania doesn't necessarily have mania. They're two very separate things. It just is a shame that the word mania is in the word trichotillomania. But hair pulling is seen as a compulsive symptom as part of the compulsive set of illnesses in the DSM, which is the kind of diagnostic categorization of mental illnesses. And mania is a mood disorder that you see in bipolar illness, which is in a separate chapter altogether. And although they can coexist, they don't have an influence on one another, or one doesn't necessarily suggest the other. Now, although historically trichotillomania was an impulse control issue, it's now in the compulsion section of the DSM, and I guess impulse and compulsions they do overlap somewhat, but compulsion is really an issue in stopping. So you see that in obsessive compulsive disorder, where you have a repetitive behavior that you can't stop, and it's really used to treat a kind of underlying anxiety or drive. And impulse related behaviors is really issues in not starting. You're impulsive, you just can't help it, you just start, you just do something disruptive or impulsive, or spending too much money, tics, and that's impulse kind of things. But compulsion is issues stopping. It's hard to stop. So pulling hair, it's something that it's treating an anxiety, and it's very hard to stop, and it's getting to the point where it's causing some kind of functional impairment, which is a very general term, which I guess can just mean injury or effects in relationships or problems at work. And to be honest, it's not necessarily something I see commonly in hospitals. Usually people with trichotillomania can function quite normally, and they often cover up the hair spots, or the bald spots, I should say. But I have seen it a couple of times as part of someone's, they might come into hospital for a psychotic illness, or an adjustment disorder, or they're in a difficult social situation, or it's a difficult depression, and they have a comorbidity of trichotillomania. Now, typically when someone has trichotillomania, it's not just kind of pulling out your hair when you're stressed and focus, when you're being distracted by something else and you realize you pull out hair. It's a very deliberate action where you have this build-up of attention where you need to pull your hair out, and it's almost anxiety-provoking to not do it, and then it's followed by plucking a hair, usually one at a time. Sometimes people even like looking at the hair, inspecting the hair. Some people get really satisfied when they have the bulb of the hair, the hair root, and some people even eat the hair. That's known as pica, and that can be very dangerous. People who eat large amounts of hair can get, you might not have heard of this, but they can get a human hairball, and that's got an interesting name. It's called, I have forgotten what it's called. I'm just going to Google it. It's like, it's got a, hang on, let's see if I can remember it. Trichobozoa. So, Google it if you want to see what they look like, but they can be really dangerous, trichobozoas, because they can plug, the intestinal system and cause an obstruction, which can be a life-threatening situation, and they might have to get removed surgically via endoscopy. So, I often do an abdominal examination as part of my medical workup with someone who has trichotillomania and pica, where they eat the hair, and if you can feel a mass and if they haven't pooed for a couple of days, then that's kind of red flags that you've got to do further investigation and talk to the gastroenterology team. So other than eating it, people do sometimes play with their hair, feel the hair, inspect the hair, like I said. And for anything to be considered a disorder in psychiatry, it does have to cause functional impairment, as I said, and that can just be significant distress. There's often some shame associated with this, and people often cover up where they pull hair from. Hair can get pulled from anywhere. It's not just from the head. I've seen it on kind of the scalp with a bandana or a hat, kind of covering it up. But people pull eyelashes commonly or eyebrows. Anywhere where there's hair, you can have trichotillomania. So as I was saying, pulling the hair is kind of a self-treating a build-up of tension. You have the build-up of tension, it's anxiety provoking, and you pull out the hair to treat that kind of build-up of tension. But you can imagine then that someone who is in a negative emotional state and quite anxious, if you're getting overwhelmed by work, that it can also be a way of kind of calming and self-soothing and treating one's own anxiety. It would be considered a maladaptive defense mechanism, a maladaptive strategy to treating, one's anxiety. There's healthier ways to do it, but that might take some retraining in psychotherapy to find healthier strategies. But I guess what I'm trying to say is, if you have a comorbid anxiety disorder, it would be important to address both mental illnesses, not just one. And that's always the case with, dual diagnoses. In severe cases, people have been, I haven't seen this before myself, but they have been known to pull hairs from other things. So pulling apart sweaters and their own hair, or even pets, which can obviously go into the realm of animal abuse. I guess if it's a pet that sheds, then that's not a problem because the hair will shed out. I haven't, as I said, met patients that have had that severe a form, but it would be interesting to talk to them about it and find out if does the hair need to be plucked from the skin, or does just pulling, I don't know if you've ever had like a big dog that sheds, but there's just clumps of hair that come out, and if that satisfies their build-up of tension, is that enough? Because that would be, not a big. That would probably be a healthy way to redirect the behavior. So I feel like we've talked a lot about the trichotillomania. The next thing we're talking about, and we've touched on already, is the excoriation disorder. This is skin picking, and excoriation really sounds like what it is. It's a word that has the sound of what it is. It's the forming of sores usually it's picking with fingernails, and to the point where blood is drawn. Some people use instruments. Some people use nail clippers, tweezers, biting. Some people, I guess, it can extend into self-harm via cutting. Some people who self-harm via cutting, it's to treat a kind of build-up of tension and to release that tension, which is the same reason people might do skin picking, not as a act to end one's life and bleed out, but rather to treat an emotional disturbance. Again, it would be considered a maladaptive treatment approach. There are healthier ways to address build-up of anxious tension, but that takes effort, psychotherapy, good rapport, and a lot of work. It can be really tricky to treat the sores because often picking at the scabs and of the lesions is part of the disorder as well, so they often don't heal. There have been, I remember in an exam that I had, one of the questions was about an excoriation disorder where someone also had a factitious disorder. So they were injuring themselves, but saying it was some infection. So they were saying it was an illness that it wasn't. And the treatment was to put a cast over the excoriation disorder so that they couldn't reach it to pick at it and to see if it would heal or not. Because this lesion that hadn't healed for 6 years suddenly healed in 2 weeks once there was a cast over it, because it prevented the person from itching it. So that's not a real scenario, but that's an interesting point to make, that these things won't heal if people continue to pick at them. They often don't go past the dermis and into kind of open large blood vessels, so sepsis isn't that big a concern. They're usually quite superficial. But if they do go deep enough, you can get a serious infection, and you can get a cellulitis where the tissue and the skin around the sore gets infected by the flora on the skin. I mean, it's important to remember the role of skin is a barrier, and when you are picking at it, that's breaking the barrier. And again, there's an element of distress and functional impairment from this, and shame, and often people will cover up where the sores are, and it can be very disabling. The average age of onset is usually in the adolescent years, and you might also get other mental illnesses that come and are diagnosed with it, like an anxiety disorder, like generalized anxiety disorder, and the severity of the illness can be episodic, so it can go into periods of remission, maybe when there's a less stressful time in life, and get worse when there's a more stressful time in life. But it's usually pervasive and lasts years until people learn different defense mechanisms and strategies to address that buildup of anxious tension that leads to the compulsive behavior. So I guess now we need to talk about treatments, and mild cases often will... I don't think spontaneously resolve is the right language. Usually people will kind of... They will resolve, but it's because people are finding strategies to deal with their own problems. It's not spontaneous. It's usually through work and consciously. It resolves. Usually it's via distraction or finding other ways to manage the buildup of anxiety. I know some people will use a bucket of ice, put their hand in the bucket of ice to kind of treat the need to get that sensory stimuli, but ice won't cause the same level of damage that skin picking might cause. And so finding different strategies for mild cases of excoriation disorder or trichotillomania is really important. I guess another part of treatment is really to get the accurate diagnosis. So seeing a psychiatrist and getting a holistic assessment, because a lot of people with one of these illnesses might have the other, and a lot of people with both might have OCD, tic disorders, generalized anxiety disorders. There's a lot of comorbidities that are possible, and you need a thorough assessment to know that, because again, complex problems have complex solutions, and you need holistic approaches with a biological component, such as maybe medications, a psychological component with a psychologist, and a psychosocial cultural component with, different, group. You work it out with your psychiatrist and your treating team, but you want to get that holistic approach. Now, while we're on the point of the psychological component, it's worth noting that the mainstay of treatment is a psychological therapy. It's a type of cognitive behavioral therapy, which is kind of a genre or one area of therapy. It's called decoupling therapy. So you need to become quite mindful. You need to understand your body and the feelings it gets, and you need to feel the buildup of tension that makes you want to do whatever behavior. Let's call it hair pulling. And instead of hair pulling, you need to find a alternative behavior to do. So the ice bucket could include one. I don't know. You try and find something that'll work. Maybe like a squeezy stress ball could be the other another example. You kind of find something that works for you. But what you're trying to do is change the neuronal pathway from going to hair pulling. You're trying to go to squeeze a stress ball, so that you're remapping those neurons. So when you get the build up of tension, you can do something else that doesn't cause distress and functional impairment. So that's the kind of simple, the simple summary of decoupling therapy. It's easier said than done. It's a lot of hard work in reality. It's like going to the gym. It takes a lot of repetition, a lot of reps, a lot of sets, a lot of time and effort. And I really admire anyone who does psychotherapy intensely, because it's hard work, but it's really important, and you can have really good outcomes with it. Now, in terms of medications, there are some supplements that have a bit of evidence around them. There's some papers talking about N-acetylcysteine and inositol. You don't need a prescription for those, but talk to your doctor about them, of course. And some doctors might trial antidepressants for severe cases, and with the thinking that it works the same way that it would work with other compulsive disorders. So high dose SSRIs are used in OCD and have good efficacy there. but there's side effects, so you have to weigh up pros and cons and talk to your doctor about if it's right for you. And it's worth just always acknowledging that keeping a generally healthy lifestyle can only make things better. So getting into yoga, doing lots of exercise, healthy diet, all the general health stuff is only a good thing. So with that, that's all I wanted to kind of talk about. I think it's an important illness to raise awareness for. And if you have a friend with it, talk to them, see if there's anything that they can, talk about strategies, talk about ideas, see what helps, what doesn't help. And if you're suffering from it and you're just scared to see a doctor, please don't be scared. Just get to the door. Let the doctor will do the rest. Just get to the door, explain the problem, and just try, give them a chance. And I'm sure that good things will happen. And in Australia, you get a mental health care plan if you see your GP, so that can help you get cheaper psychology reviews as well, which is really good. But that is it for this video. I wish you all a beautiful day. I encourage you all to call a friend, tell them you love them, and all that good stuff. Create some connection and love in the world. And I'll see you all in the next video. All right? Okay, bye for now.